you will get.
Yes, so hi everyone. Yes, Pranjal Kumar, hi. How are you? How is the preparation? Yashwant Kumar, how are you? How is the preparation? Milan R. It's J. Okay, fine. So shall we start? I'm audible and visible. Say yes or no. Milan R. Okay. So that can be a question in genetics. Okay. We do chant syndrome, chromosomal structural abnormalities. Okay. So let's start. So let's discuss five important questions. So a clinical question that can be asked in your exam, and some more questions we'll have discussion in the evening, somewhere in the 9:30 or 10 o'clock. Okay. Yes. Chalo. Right. Fine. So this is one question asked, very commonly asked in the exam. A 40-year-old patient presents with persistent pain in the upper abdomen. Pain in the upper abdomen, which worsens after meals. Upon examination, it is found that the patient has tenderness on palpation in the epigastric region. So, having tenderness in the epigastric region, name the organ present in this region, describe the blood supply and lymphatic drainage. Yes, can answer this? Can answer? What is the probable question asked here? 40-year-old. Okay, 40-year pain after meals. The pain after meals, tenderness, tenderness. What is this basically? Is it Felix? Okay, is it stomach or duodenum? Basically, question asked about peptic ulcer disease. Peptic ulcer disease. Peptic ulcer can be gastric ulcer disease or duodenum. Okay, what is the best answer? What is the probable the question asked in the exam? Just come on, guys. Okay, fine, guys. What is the best answer? So the pain after meals, it must be gastric ulcer. The pain before meals or the pain relieves after meals, that is duodenal ulcer. So the answer here is stomach. Basically the stomach. The clue is the pain after meals. Okay, answer is stomach. Good. So the blood supply from, what is the blood supply? What are 5 important arteries of stomach? Let's see who is going to answer. Let's see. The blood supply of stomach. So as you know, it is left gastric artery, right gastric artery, short gastric artery. Okay. I know. So there are 5 arteries important, right? So can anyone answer? Let's see who is going to answer. Yes, very good. Gastroepiploic artery. Gastroepiploic artery. This is fourth, and the fifth one is basically the right gastroepiploic artery. Right gastroepiploic artery. So short gastric artery are the branches from short gastric artery are branches from. So this is very important, guys. So left gastric artery, right short gastric artery, left gastroepiploic artery, right gastroepiploic artery, right? So this is important. Just try to memorize. Left gastric artery is a branch of celiac artery. Right gastric artery is a branch of hepatic artery. So how to remember? So the liver is present on the right side. So right gastric artery, that is basically hepatic artery, that is liver. Short gastric artery, MCQ, splenic artery. Left gastroepiploic artery from splenic artery. Right gastroepiploic artery is a branch of hepatic artery again, which is the gastroduodenal branch. So I'll write in the chat box. Short gastric is equal to splenic artery. So write this in chat box. This is very important MCQ. Short gastric is equal to splenic. Splenic. Okay. So the next clinical scenario. This is the clinical scenario. All of you go through the clinical scenario and try to answer. Try yourself. Let's make it interactive. A patient came to OPD with a history of pain and bleeding on passing stools. That was a suffering from hemorrhoids. Describe the features in the interior of renal canal. Add a note on its blood supply. The question is asked about anal canal and very important clinical question. My question is it internal hemorrhoid or external hemorrhoid? Internal or external? Kiran B. Patil. Is it internal or external? The patient is having pain, painful hemorrhoid, on passing stool. Question is internal hemorrhoid or external hemorrhoid. As you know, treatment is conservative as well as surgery, that is hemorrhoidectomy. Right? Yes, very good. The Felix answered correctly. Felix, good answer. So the answer is external hemorrhoid. Good answer. Good. External. External hemorrhoid. Right. Okay. So this is one very important image. You need to practice today. The interior of anal canal. You need to write anal column, anal valve, pectinate line. 3 marks question. 3 marks question. Pectinate line. Pecten. White line of Hilton. 3 marks question. Anal watch and upper part is from the endoderm, lower part is from the ectoderm. Ectoderm. So this is important one, very important one. Yes, can you practice this diagram, all of you? Dora, Likit, Felix, Kiran T. Patil. So the must know image can be a 3 mark question, label diagram, can be a 5 mark question, can be main question as well. You need to practice this and also the difference between pectinate line and Hilton line. Very important. Hilton line. Yes, Grandma Patil. Yes. Yeah. The next clinical scenario. Next clinical scenario. All of you try to answer this. A 68-year-old female presented with increased frequency of micturition. So there is a polyuria and polydipsia is there. Polydipsia and polyphagia. Diagnosed with diabetes mellitus. Very simple question. So name the organ which secretes the insulin. Mention the parts, blood supply relations. This is very simple, straightforward question asked in your RGUHS. This can be modified in your upcoming exam. So remember, diabetes mellitus. The answer is, what is the answer, guys? Okay, Dora is answering. Sir, this is pancreas and beta cells. Yes, very good. So the answer is pancreas. Pancreas. Fine, easy. Now this is very important diagram. Very, very important diagram. The parts of the pancreas, the head, neck, body, and tail. The second part of duodenum, major duodenal papilla, minor duodenal papilla. So you need to write this label diagram in your exam. Can anyone tell me what are ducts of pancreas? What are ducts of pancreas? What is the name given to that? Very important. Duct of pancreas. 3 marks question. Duct of pancreas. Yes, ducts of pancreas. What are the ducts of pancreas? Yes, lick it. No, no, no. Cystic duct is not the duct of pancreas. Cystic duct is the duct of gallbladder. Yes, Kiran B. Patil is a duct of Wilson, duct of Santorini. So there is a main duct, that is a duct of Wilson, and accessory duct that is known as Santorini. Santorini. All of you write in the chat box. Santorini and Wilson. The main duct, when it is blocked, there can be pancreatitis. That is known as acute pancreatitis. Acute pancreatitis. Vinay, very good. Good answer. So, okay. Hello. So, the Dora, nothing. You need to practice some questions. Nothing else. There is no secret in that. You need to practice, try to understand the concept. So all of you write in the chat box, Virsang and Santorini. And one more important concept is the development. Development of pancreas. Very important. So development is from dorsal pancreatic bud and ventral pancreatic bud and derivatives. Very important. So after the class, go through this. So important 3 mark question. Important 3 mark question. Annular pancreas, pancreatic divisum, commonly asked. Annular pancreas, pancreatic divisum can lead to obstruction of second part of duodenum. Then you can write about pancreatitis, acute pancreatitis, chronic pancreatitis. So in exam you can write 1 point pancreatitis. What is the commonest cause of pancreatitis? What is the commonest cause of pancreatitis? Let's see who is going to answer. What is the commonest cause of pancreatitis? Yes, Vinay, okay. Vinay, fine. What is the cause of pancreatitis? Use your common sense to try to answer. Pancreatitis means inflammation of pancreas. It leads to severe pain. It leads to death, which is high mortality. So the question is cause. What is the cause? Bacterial? No, Felix. Common cause, not the bacteria. I'm asking you. What is the common cause? Let's see who is going to answer. The two common causes are, one is alcohol. The second one is the gallstone. Gallstones. Two common causes. Yes, mumps can lead to that. Yes, that's okay. Fine. Infections, some certain drugs. Okay, the common causes are alcohol and gallstones. Alcohol and gallstones. Okay. So this is about pancreas. Pancreas is very important. So this is the structure of pancreas. You can see head, the neck, considerate process, body, and the tail. Okay. Can anyone tell me where Langerhans cells are concentrated? What is the site of pancreas where Langerhans cells are present? More Langerhans cells. Yes, click it. Very good. Good. Pancreas is okay. Sure. Next question. Next clinical question. All of you go through this. Fourth question. Fourth question. A patient is brought to emergency department with a history of stab wound to the abdomen. Stab wound is there. Basically, the question is already given. The stomach bed is injured. What are the structures forming stomach bed? So this can be modified in your upcoming exam. So here directly mentioned it is stomach bed, but in upcoming exam they can ask you the question: what are the structures forming it? Yes, one structure which forms stomach bed. Yes, in pancreatectomy tail is preserved. Tail is preserved. That's great. That's great answer. What are structures? So the stomach bed formed by structures. The mnemonic is Dr. SS kills patient cruelly and mercilessly. So a funny mnemonic. Dr. SS. D for that is left crest of diaphragm. S is there, no sphenic artery. Suprarenal gland, left side. Remember, left suprarenal gland. Left kidney. Body of pancreas. And left colic flexion. And transverse mesocolon. M for mesocolon. Transverse mesocolon. So if you want, you can remember the mnemonic. So M is missing there. The M is basically transverse mesocolon. M for mesocolon. So this is funny mnemonic. If you want, you can just remember. Just remember, right? I'll have to write the mnemonic. Just write the mnemonic. Dr. SS kills patient cruelly and mercilessly. Just write. Don't worry. So this can come in your exam. So this can give you around 2 or 3 marks in upcoming exam. And you need to write about the label diagram. Yes, lick it. Please write. Lick it. Write the structures forming in stomach bed. And the last question of the discussion. So this is the fifth question. So all of you just go through the question, try to answer. Try to answer this question. So a 24-year-old woman presents to emergency room, abdominal pain for the past 6 hours. So there is a pain is there. Patient is having pain. Pain located around the umbilical area migrated to right iliac fossa. Described as 8 to 10 severe pain and there's a tenderness is there. What is the best answer, guys? So 24-year-old 24-year-old woman with the pain on the right quadrant, and there's a guarding is there. Guarding tenderness is there. Tenderness is there. What is this? What is this condition? So Kiran B. Patil. Yes, very good. So this is basically appendicitis. Appendicitis. Okay, acute appendicitis. The commonest cause is fecolith. And remember McBurney point, very commonly asked. McBurney point. Very important clinical scenario. Now, in appendix, the important question is what are the positions of appendix? There are 6 positions of appendix. Can anyone answer? What are different positions of appendix? Positions of appendix. Frequently asked. Let's see who is going to answer. So Dora and others. Sir, paracolic. So some student answers are paracolic. Paracolic. Pelvic. Okay. Pelvic. 2 position. Any other? Retrocecal. RC. Retrocecal. Pre-ileal. Pre-ileal. Post-ileal. So 1, 2, 3, 4, 5. One more is missing. What is one more? One more position of appendix. So this is very important, guys. So mid-inguinal. Good answer. Mid-inguinal. So retrocecal is the most common one. Very commonly asked. Then it can be splenic, promontoric, pelvic, subcecal, paracolic or paracecal. Okay, paracolic or paracecal. So these are all basically the positions of appendix. So this completes your 5 important questions. So in half an hour, just go through this. Just go through this, all of you, all the 5 topics. So let's come up with 5 more important questions in the evening. Okay. Thank you all.